But I got to say, it's kind of like Christmas in a way. I am starting to really get into this. Like when you hear that first Christmas song that grabs you, it's time to celebrate America. It's always time to celebrate America, but to take it to the next step. And in part because we have, a large part, because not only do we have the demand by the country, but we have an administration that is active, that is forward looking, that wants to solve problems. And there are a lot of them on a lot of fronts. In America, one of the biggest issues happens to be healthcare costs. And opportunity again, and effort and work being done to do something about it, not just talk about it, have a commission hearing about it, but to do something about it. So, how do we attack? How does the Trump administration effectively attack the hidden healthcare costs that so many Americans face? Ambassador Andrew Bremberg joins me now to talk about the Trump administration's full-scale war on healthcare fraud. And Ambassador, it's great to have you here. Thank you for joining me.
Great. Thanks for having me.
So let's take it head on. And you have the experience from being there in the first administration. Let's go through these concrete actions that should be taken, that are being taken in some cases, to deal with this issue that really affects so many Americans, especially older Americans.
Yeah, well, as you said, it's been great to see the administration come out aggressively against the healthcare fraud we've seen, particularly in the Medicare and Medicaid program. So many of the announcements, whether it's by Vice President Vance or Secretary Kennedy and Dr. Oz at CMS over the last couple of weeks, have really shown the progress they've made in tackling fraud, fraud against the taxpayer through these huge and important healthcare programs. But the areas that I focused on were additional areas that they can start taking action on to help more Americans stop being victims of fraud across the whole healthcare system. As I'm sure you know, most Americans today still get their health care and health insurance through an employer-sponsored plan. And right now, millions of Americans have no idea how much healthcare costs before they go to seek care. And this is something that, doesn't make sense. If you're a conservative free marketer, obviously we know markets work. You need to have prices in order to have any competition. And, none of us have ever seen the price of most healthcare before we've ever gotten it. At most, you get some sort of explanation afterwards that tells you, what you're going to end up paying. You have no control. You have no agency, no choice. And the irony or shame is that in his first term, President Trump signed a law at the very end of his first term that said, you should see the prices before you get care. That you, instead of getting just an explanation of benefits, 3, 6 weeks, months after you get care, as long as it's non-emergency scheduled care, which over 90% of care is scheduled in advance, you should see the price up front. And unfortunately, the Biden administration never implemented this. This is supposed to go into effect literally 4 years ago in 2022, and it's never happened. And it's something I think that President Trump in term 2 can see and get done, which would ensure that every American, if they have scheduled health care, they see a price up front before it. So no surprise bills, no fraudulent upcoding and overbilling afterwards. You see a price up front, you get your care, and that's what you pay.
All right, so that's I'll put it on this term, the transparency part of this, and that is an important part. Look, the reality is, and I've been through this like many Americans, you get the bill, we bill the healthcare provider for this, and this is your portion, your copay, in-network, out-of-network, and then if you have a question, God help you trying to get through something or find out. And frankly, we need to be proactive ahead of just going in for a procedure, but that's, just a pedestrian view of it. Let's talk about other things that can be done, Ambassador. The Federal Employee Health Program, it gets occasional attention. You get the headline, the benefits they get and more, but what can be done? Because that is a big, big cost driver.
Absolutely. It's a huge healthcare program, separate from Medicare and Medicaid that most people are familiar with. The federal government employs millions of workers, and including retirees that still get their health care through what's called the Federal Employee Health Program. And this is administered by the Office of Personnel Management, again, the federal agency most people have never even heard of, and is one of the largest health plans, period, spending tens of billions of dollars every year. And it's been grossly mismanaged. And this is a huge opportunity to fight fraud by both providers and especially the health insurance carriers that work for the federal government in this plan. So just to give a context of how this works, what happens is employees will sign up for a health plan offered by one of the different major carriers, the Blues, United, Cigna, whomever. And what happens is OPM then pays them to provide the care and cover all the healthcare costs that the worker, then gets, and that's split through premiums. And what's happened is that it has become an open spigot. As we've seen in the Medicare and Medicaid fraud, as soon as the government opens up an open spigot, people go to figure out how to get as much money out as they can. And that's what these carriers have been doing. Now, the first step you would think you would do is, okay, we're going to pay you to do that, but we're going to see the receipts, right? Every quarter, day, year, whatever, we're going to see the receipts. We're going to see we paid out X, you paid this to different providers, and we're going to, make sure, we're going to audit it. It's going to make sure the numbers are right. Just how every business person runs their business. No, none of that is happening today. The federal government does not see the receipts for what healthcare they're actually paying for, and there is no insight to what's happening here. So we know, and every time there's an office assistant inspector general or the GAO do these kind of small scale investigations and reviews, they find hundreds of millions, if not billions of dollars of overpayments, mispayments, fraud, and it doesn't even get collected. So this is a huge opportunity for the vice president and the task force to focus in on the federal employee health benefit, to run it like you would run any other business. And, don't just, take the big insurer's word for it that they're being good stewards of
your money.
They show you they're not.
They're being really good stewards of your money. By the way, sadly, as I'm listening to you, Ambassador, I think of so many other areas, federal housing programs, education, Pell Grant systems, and so on. Whenever there's this seemingly bottomless pit of available money, there's somebody looking for their cut, for their share of it. So it's unfortunate that this is not just related to health, it's related to so many other government or government-related or overrun programs.
That's right. And as we've seen, in these other fraud cases that the administration started to tackle, it doesn't take much work, right? You just want to go see the receipts. Where is this care happening? Where is it going on? Are there people actually being served? In the federal employee program, again, we don't have the exact numbers. There are estimates that there are potentially hundreds of thousands of individuals enrolled in these plans that aren't even eligible for the plan. So again, these are basic blocking and tackling activities that need to happen as you administer any program. You need to make sure that you track eligibility and that you follow the money, right? Get the receipts and see what was the care paid for, how much did we pay for this care, just like any other company does this. And speaking of other companies, this is also something that all the large employers around our country need better access to. All of them provide health insurance for their workers. Most of them are what's called self-insured, so that even though they use an insurance company to provide the health care, they're actually maintaining the risk. The insurance company just pays the healthcare claims using the employer's funds. And again, in this case, the employers have frequently been blind to some of the highest costs they have on their books in terms of paying for employee healthcare. They don't see the receipts. So this is another action that the Trump administration through the Department of Labor can take to ensure that self-insured plans see the receipts. This is the most basic anti-fraud principle, which is like, you actually want to see, what did we pay? Show me the receipts, file the paperwork, let's see it. We'll have open, transparent, honesty, financial transactions, and we know we can trust it. That's not happening today, and the Trump administration can easily fix that.
Yeah, boy, I would love to have about an hour and a half with you to talk about fiduciary responsibility in both private and public corporations, in exactly what you just said, those self-insured corporations, and they have thrown away their responsibility to their shareholders with the amount of waste because of this lack of transparency and accountability. On to another part of this, and one of your 3 points that you wrote about in a Fox opinion piece, titled 3 Steps That Could Stop Fraud and Make Healthcare More Affordable for All Americans. Let's talk about the PBMs. And boy, that has gotten a lot of attention. I don't think I've ever seen an administration first time around and now give attention to the pharmacy benefit managers and the third-party administrators. What needs to be done there?
Yeah, this is a space where the administration deserves great credit for taking actions to go after this kind of spread pricing that takes place through PBMs that are coming in and play this role in between the pharmaceutical companies and your healthcare plan. Look, it's important to negotiate, as President Trump has shown. It's important to negotiate and be tough with the big pharmaceutical manufacturers to lower prices. That's a great thing. The problem is when the PBMs are doing this right now, it's obfuscated and they don't show what savings actually accrue to whether a patient or an employer that uses them to get that care. So this is a key part of what the administration has already done. President Trump's signed a law, omnibus bills that contained reforms on PBMs to make them more transparent. The Department of Labor regulation is already moving forward to make financial disclosures by PBMs required as part of the fiduciary duty of the self-insured employer plans. But the real opportunity is to expand this beyond just the PBMs to the TPAs, or as you said, the third-party administrators, the health insurance companies that cover the rest of the care. When you look at a company or anyone's healthcare plan, roughly 20% will be covered by, pharmacy benefits. The 80% is your major medical plan, and that's where so much of the spread pricing, and I think fraud is taking place, and the need there is to show the same type of transparency inside those transactions that we're targeting in the PBM space need to happen also on the insurance carrier side to make sure that across the entire plan, the last thing you want to do is push on one side of the balloon and just push the fraud over to the other side, right? So the key is covering the entire health plan, making sure we've got radical transparency throughout the entire system.
This is a great piece for everyone to read. It's at Fox News. It's an opinion piece by my guest, Ambassador Andrew Bremberg, who previously served as assistant to the president and director of the Domestic Policy Council. And this really is about executing policy, executing oversight, and your point about not just pushing this to another side of the balloon, that you have to tackle these issues because they are complex and they have many tentacles from different angles. And that's how you begin to, to continue the, the analogy, reduce the size of the balloon. I'll put it that way.
Absolutely.
Ambassador, it's a real pleasure to talk to you. Keep up the great work. Keep letting us know how things are really working and what needs to be done.
Great. Thank you.
Again, Ambassador Andrew Bremberg, former assistant to the president and a former director of the Domestic Policy Council. His Fox News opinion piece is out there for everyone to read. 3 steps that could stop fraud and make healthcare more affordable for all Americans. And you heard the 3 main steps there and a lot more discussion. 866-95-PATRIOT, 957-2874. Look it up on foxnews.com. I'll put it up on my X post stream for the show later on. 866-95-PATRIOT.